All right. Hi, everybody. Welcome to our first installment of this IBS Awareness Month Clinical Education webinar series. My name is Joe. I'm the head of provider partnerships for the US here at Mindset Health and Nerva. Joined with me is Claire. Maybe Claire, you want to give a quick introduction to yourself as well?
Yeah, thank you. And thank you, everyone, for joining. I am Claire Hall. I'm the research lead at Nerva and Mindset Health. So I'm just here to support and facilitate the Q&A afterwards.
Awesome. Thanks, Claire. All right. So yeah, let's dive in. Today we're here to talk about optimizing IBS care with Nerva. All right, just for a quick agenda for the presentation today, I want to give a really quick introduction to us, who we are, and a little bit about Nerva, and then talk a lot about IBS management and the Nerva program. So specifically, we'll be covering gut-directed hypnotherapy and the research and background behind gut-directed hypnotherapy as an approach for IBS. Also talk a little bit about Nerva, the Nerva program, and how it works, the research and outcomes that we've published relating to the program. And then finally, we'll close with a little bit about who and how to refer your patients to Nerva. Really quick introduction to us. I work for Mindset Health. We are the makers of Nerva. Nerva is an evidence-based gut-directed hypnotherapy program for IBS. Nerva was developed in partnership with Dr. Simone Peters from Monash University and the Mind Gut Clinic as a digitally delivered gut-directed hypnotherapy program. To date, Nerva has been referred to patients by over 11,000 clinicians, and we've had about 300,000 patients go through the program to date. Many of you on the call, I'm sure, are familiar with IBS, but for those who are a little bit less familiar, irritable bowel syndrome is the most prevalent disorder of gut-brain interaction. IBS symptoms, which occur in the GI system, can be caused by both physiological factors in the gut, but also psychological factors in the brain. And the gut and the brain are connected by a complex network of nerves along the gut-brain axis. And what we often see is that miscommunication along this gut-brain axis can actually lead to a worsening of IBS symptoms. Physiological factors that can contribute to symptoms in patients with IBS could be, for example, hyper visceral sensitivity, infections, altered gut microbiota, immunological changes, or altered motility. And then similarly on the psychological side, we have heightened pain perception, psychological disorders, GI-related anxiety and behavioral changes, and changes in both the gut and the brain communicate with each other along a series of nerves that connect the two, and can lead to a cycle of worsening GI symptoms particularly in patients with IBS. Directed psychotherapies are a therapeutic approach to helping better manage IBS symptoms and are actually recommended by both the AGA and the American College of Gastroenterology in the US for the treatment of global symptoms in patients with IBS. Gut-directed psychotherapies is a class of different approaches to managing IBS symptoms that includes gut-directed hypnotherapy, cognitive behavioral therapy, mindfulness-based stress reduction, as well as relaxation training. There's a really large and growing body of research that supports these different modalities for the better management of IBS symptoms. And one study in particular that's super interesting was a 2016 study by Dr. Simone Peters that compared gut-directed hypnotherapy delivered in person to the low FODMAP diet. And what they found in that study, interestingly, was that both gut-directed hypnotherapy and the low FODMAP diet were equivalent at reducing patients' symptom severity scores over 6 weeks and 6 months. So a GI psychotherapy acting on a different mechanism of action to diet therapy was equivalent and providing an alternative option for patients managing IBS. There's also a growing body of research that supports a more integrated care model and improvement in patient outcomes. So research has shown that when patients with IBS receive care from a multidisciplinary care team, one that incorporates both medical management through their gastroenterologist or their advanced practice practitioner, together with dietary management and GI social management, through a GI psychologist or otherwise, those patients tend to have better outcomes. And the rationale there is that there's a multitude of different factors that are contributing to a patient's clinical presentation of IBS. Taking that multidisciplinary approach helps improve patient outcomes and improve quality of life. The problem with this integrated care model, while it shows great outcomes in research studies, is that in practice, it's very difficult for a clinical team to have all of the right pieces of the puzzle together within the same referral network and available for a patient to access. Specifically, GI psychologists in particular are quite a rare breed. If you are lucky enough to have access to one and to be able to refer to one, that's a huge asset for your patients. But generally, the availability of GI psychologists is quite limited if you're able to find a referral at all. Typically, if you do have a referral, the wait list can be upwards of 6 months to get an appointment. And oftentimes these services aren't covered by insurance. And for patients who either don't have coverage through their insurance or have high deductible health plans, costs can be anywhere from $150 to $200 per visit, typically requiring several visits over the course of a month or several months. So accessibility for patients becomes a real challenge. That access problem that we talked about, as well as the research that has been ongoing in GI psychotherapy, is the reason why we created the Nerva program as a tool that helps enable access to evidence-based guideline recommended options for patients with IBS. The Nerva program was developed off the protocol that was used in the 2016 gut-directed hypnotherapy paper that we talked about earlier, developed by Dr. Simone Peters. Nerva is a 6-week daily gut-directed hypnotherapy program. Patients will listen to 15 to 20-minute audio sessions every day over the course of 6 weeks. There's also a variety of CBT-based psychoeducation readings included in the app, diaphragmatic breathing exercises, a flare-up toolkit, and then we're also tracking symptoms as part of the program. So patients are recording their IBS VAS scores and your PHQ-4 scores during and after the program. They also get access to real-time customer support. And all of this is made available to patients for the cost of effectively one in-person session with a GI psychologist. Access to the app for 12 months, and with a lot of medical necessity can be approved through HSA and FSA as well. What are the components of a Nerva session, and how does a Nerva session actually work? So there are three main components to a Nerva session. The first is what's called hypnotic induction. And this you can think about kind of like meditation, kind of like that initial relaxation phase where the patient is getting comfortable, connecting with themselves, finding a safe space for them to relax and turn their attention inward. The next phase of a session is called guided visualization. This is a phase of a session where we're having the user connect with their physiology. We use a variety of metaphors in order for the patient to feel more in tune with their GI system, and I'll talk about that a little bit more on the next slide. And then finally, the third component of the session is what's called the therapeutic suggestions, and these are gentle recommendations that help the patient visualize an improvement in their GI system and their overall health. When they're in that relaxed state, following the hypnotic induction, their subconscious is much more receptive to the positive recommendations that the app is delivering, gut-directed hypnotherapy is delivering. And as a result, you can actually train that subconscious to reflexively respond to the triggers, say symptoms in the gut, in a more productive way that helps the patient feel more in control of their symptoms and better manage their IBS. Just to give you some examples of some of the metaphors and the therapeutic suggestions that the app would deliver to patients, we use metaphors, again, as a way of connecting an individual with their physiology. Really great example of this would be the river metaphor. So you can think about the flow of the GI system like a river, and if that flow of the river initially is a bit slower than you would like, that may be representative, for example, of an IBS constipation predominant patient. And we'll have the patient connect with how they're currently feeling, the current physiology of their GI system, and then we'll have them think about changes that are productive to those metaphors. For example, increasing the flow of a river for a constipation predominant patient would represent their motility improving and the passage of stool through the GI system increasing its transit time. Um, we also provide more general, gentle suggestions to the patient, again, when they're in that relaxed state. Some examples of that would be, improvements in pain and bloating. Like there will be no more pain, no more bloating, no more discomfort. Your bowel habits will continue to improve day by day and week by week, and month by month, and you'll continue to get better and better and better. And what happens over the course of a 6-week gut-directed hypnotherapy program is that the patient hears these different suggestions and these different metaphors time and time again, and then you begin to train that subconscious again, like I said, to reflexively respond to the onset of new symptoms and remind itself and remind the brain that things are getting better and your motility is going to be improving, and that the false alarms that are typically coming from the gut when new symptoms are experienced are not something to worry about, not something to build anxiety or stress about, and ultimately help the patient feel better in the moment when they're out of that nervous session and going about their day-to-day routine. So we talked a little bit about the research behind GI psychotherapies and gut-directed hypnotherapy generally. The Nerva program itself has also been researched. Um, this paper was published just last year, where we looked at the Nerva program compared to an active app-based control. In a randomized controlled trial, we had 244 patients participate in the trial, and in this particular study, 81% of participants who completed the Nerva program saw greater than a 50-point reduction in their IBS symptom severity scores relative to the active control group. So app-based gut-directed hypnotherapy was effective in this patient population, and helped the patients that participated in this study better control their IBS symptoms. We've also looked at outcomes in the real world. So again, publishing RCTs is great, but the real world happens in the real world. And we also looked at outcomes of patients who have gone through the program just through referrals from their physicians. And in the retrospective studies that we've published, we do see significant improvements in management of overall IBS symptoms, abdominal pain, gas, bloating, and nausea, and stool consistency. Interestingly, we also ran a study with over 4,000 patients about their out-of-pocket costs associated with IBS. This is something that we don't think about too often, but patients living with chronic IBS are spending a lot of money to help themselves feel better. And at least in the study that we published here, patients halved their out-of-pocket expenses after going through the Nerva program, about a $615 estimated savings in the 6 months following completion of the Nerva program. And again, if you think about where that cost savings comes from, it's from diet modification, having to shop at different grocery stores in order to accommodate particular diet therapies. It could be paying for additional appointments with in-person healthcare providers. It could be on a variety of different remedies that folks are trying just to help themselves feel better. So there's also a cost savings that we've observed when patients are able to actually find something that'll work for their symptoms. So who is the Nerva program for? It's a question we get a lot. Generally, Nerva is appropriate for patients with irritable bowel syndrome. In research studies, there's been no difference when a patient is constipation or diarrhea predominant or has a mixed subtype. We do tend to see that patients that live with chronic stress or anxiety or depression may be more amenable to GI psychotherapy and specifically gut-directed hypnotherapy. We also have, it's appropriate for a group of people who are interested in non-pharmacological or non-dietary interventions, and specifically patients that may have overlapping disordered eating or eating disorders would be a group of patients where maybe a non-diet approach like gut-directed hypnotherapy would be most appropriate. Of course, there are a couple of contraindications. Patients with severe psychiatric disorders or active history of psychosis, unresolved psychological trauma, as an example, or cognitive impairments. In this circumstance, we would recommend you make a referral to the appropriate healthcare provider for an in-person consultation rather than deferring to the app-based experience. But generally, Nerva is an incredibly safe, and gut-directed hypnotherapy is an incredibly safe protocol and generally well fit for most patients with irritable bowel syndrome. So like I mentioned at the top of the presentation, we do have about 11,000 healthcare providers who are referring their patients to Nerva today. And that's made up of a host of different GI providers from gastroenterologists, advanced practice practitioners, registered dietitians, as well as GI psychologists. Um, and the representation is kind of broadly across the country, both academic and community settings. But generally, what we see when we have a new providing practice or new referring practice come on to referring Nerva, they're typically having their patients see 3 to 6 month wait lists for their GI psychologist appointments if they can find them at all. Generally, there's limited options for these patients beyond dietary therapy. And if a patient tries the low FODMAP diet and doesn't find success with it, as an example, there's generally not too many more options that are available to these patients. After implementing Nerva within the clinical care protocols at these practices, their patients are getting immediate access to gut-directed hypnotherapy. Patients improve their quality of life. And then we also have a handful of providers who have mentioned to us that, Nerva and gut-directed hypnotherapy sometimes is the first thing that's actually worked for these patients. And it helps keep their patients engaged outside of their appointments. So the ability to maintain that really positive relationship with patients, keep patients engaged when they're outside the office, can be a really productive and useful component of referring the program. So, if this got you thinking about particular patients in your practice that you think might benefit from access to Nerva, we do have a way of referring your patients directly to Nerva. It's more of a warm handoff. So if you go to our website, nervahealth.com/clinicians, there's a big yellow button on there that says refer. Um, on the bottom of the presentation, you should see a link that links you directly over to that webpage. Submit your referrals through that form, and we will send your patients an email with a link to them to learn a little bit more about the program, what's in it for them, how it can help them. And it also gives them a special discount for being referred by their healthcare provider. All of the patients that you refer are going to get a 7-day free trial to Nerva. So we offer a 7-day free trial because this is new to many patients, and we want people to be able to listen to a couple of sessions, experience what hypnotherapy can do for them before they make a commitment to actually purchase the program. So every patient gets a 7-day free trial. They can cancel anytime. If they do decide that the program is a good fit for them and they want to give it a go, they do get a 25% discount, which is $50 off the price of the product because they were referred by you as their provider. That discount is applied through the link that we email them. So submit the referral and we'll send them that custom link. And then importantly, we do offer all patients 100% money back guarantee if Nerva doesn't work for them. So in research studies, the vast majority of patients respond to gut-directed hypnotherapy. And if Nerva doesn't work, if the patient goes through the 6 weeks and they're in that small percentage of patients that are non-responders, we stand behind and really believe in the product and what it's capable of doing. So we offer 100% of a patient's money back if they make it through the program and it doesn't work for them or they're unhappy for whatever reason. So all in all, it's a really easy way to refer your patients and really helps get them activated. So check out the link on the bottom of the screen or on this website if you have any patients in mind that would benefit from access to Nerva. And then finally, I wanted to just close with a couple of tips on how to discuss Nerva with your patients. So the gut-brain interaction can be a new concept for many patients. So talking about the components of gut-brain axis, how stress and anxiety can actually affect the physical presentation of IBS within their body is a useful way of kind of framing how gut-directed hypnotherapy can be valuable in helping them manage their IBS. It also helps to highlight the differences between gut-directed hypnotherapy and what they're probably associating it with, which is stage hypnosis. And the fact that the two are completely different. Gut-directed hypnotherapy is based on years and years of peer-reviewed research. It's recommended in clinical guidelines. Patients are at no point during a hypnotherapy session feeling like they are stage hypnotized, as you may see in the movies. It's really more like meditation for the gut, and they're relaxed and feeling comfortable. And many patients actually end up telling us it's their favorite part of the day because it's an opportunity to turn their attention inward, do a bit of self-help and care and end up actually helping their GI symptoms as well. And then finally, we also find it very useful to help set patients' expectations about what the program will be and the time it takes. So generally, telling patients that it's about a 15 to 20-minute commitment per day, where you're listening to an audio session on your phone through your headphones, and most patients see um, results within 4 to 6 weeks. And that is the presentation. I've listed here our website. You can also get in touch with me directly via email. My email is joe.rogers@mindsethealth.com if you have any additional questions. If you are at a clinic and interested in having us come present on Lunch and Learn, or you're interested in learning a little bit more about how Nerva can be integrated into your clinical workflows, reach out to me. I'd love to chat with you and hear a little bit more about your practice.
Awesome. Thank you so much, Joe. We will jump right into some questions just because we have a few. Um, I have a question here from a provider who said, I work in an eating disorder space, so I'm very interested in using this tool for many of my clients. However, under the contraindications, it listed psychological trauma, which applies to many of my clients. They do work directly with therapists during their treatment, so that would provide enough support to refer Nerva, or can you elaborate on what might specifically show that this tool would not be a good fit for them?
Yeah, that's a great question. So, because the Nerva protocol is it's fully app based, there's no human in the loop. We really leave it up to your clinical judgment on whether the patient would be able to and interested in that sort of self-directed, automated type of intervention. Ultimately, we will default to our clinicians as the best judge of their patient's needs, and if the patient is seeking or is receiving care from a multidisciplinary care team already, um, and you feel like it's appropriate and they would, there's low risk that they could go through the program on their own, um, then I would leave it to you to make that recommendation.
Yep. And I would just add too that really when we list psychological trauma as a contraindication, that is specifically talking about patients where their unresolved psychological trauma is a primary driver of symptoms. If you can identify, or the therapist that they're working with can identify that that is a primary driver of their IBS symptoms, then Nerva is not something that is going to sort of get to that underlying psychological trauma. It's a standardized protocol that specifically talks to IBS symptoms and won't resolve that trauma. So, definitely defer to your clinical judgment, work with the therapists that are working with your patients as well, and talk about if this is appropriate. But if they are receiving care for that and that's not sort of identified as a primary driver of their symptoms, then typically it's still appropriate for those patients. Um, okay, next question. Joe, could you talk about how practitioners who use hypnotherapy in combination with Nerva in their practices can link up with their local GPs and specialists to create sort of that multidisciplinary team?
Yeah, absolutely. I think the name of the game in the healthcare industry, particularly in the US, is networking with your local practitioners. So I think the vast majority of referrals happen on a word of mouth basis. So if you have gastroenterologists, registered dietitians, GI psychologists in your local region where you're licensed to practice, getting in touch with those folks and making them aware that your services are available is definitely the most productive way of growing your referral network, growing the impact that you can have on patients, and building that multidisciplinary collaborative care team for your patients. If you're not working in a large academic medical center and you don't have the benefit of having a multidisciplinary team kind of pre-built in, you have to build that in more of an outpatient setting. And networking is with the local physicians is the way to do that.
Awesome. Can you talk about patients that have gone through Nerva and haven't seen improvement in the 6 weeks? Should they restart the program? Is it not going to be effective for them? Can you talk about that circumstance?
Yeah, that's a great question. So, there's a variety of reasons why somebody may be a non-responder if they are, completely adherent to the program and they make it through, and they're not seeing the improvement in symptom management that they are hoping for. continuing, they can definitely continue to access the program, but alternative options may be that they try more personalized in-person gut-directed hypnotherapy, for example. Those also, there's different therapeutic modalities, right? You could try cognitive behavioral therapy as an alternative, as an example. Generally, patients, at least in research studies, going through the protocol, adhering, 5 to 6 days a week over the course of 6 weeks. I think about 81% of people in those research studies have seen a reduction in their IBS symptom severity scores. So yeah, that would be my recommendation. If a patient's non-responding to digital app-delivered gut-directed hypnotherapy, they could potentially seek care from an in-person gut-directed hypnotherapist as the next approach.
Yeah. And I will say as well, just across all of the research in gut-directed hypnotherapy, it varies study to study, but it's all sort of around a 20% that seem to be non-responders. And, we know there is going to be a percentage of non-responders, albeit pretty small. If most therapies had an 80% response rate, that would be pretty amazing. So we're pretty happy with that with gut-directed hypnotherapy. But of course, in those percentage of non-responders, definitely have them seek out the money back guarantee. Again, we know there is a percentage of non-responders. We don't want them to have to pay for the program if they end up falling in that percentage. And the other thing is, back to the drawing board of that multidisciplinary approach to managing IBS. Okay, next question. Are there any concerns for patients doing the 7-day trial and feeling like it doesn't work within the initial 7 days, and thus preventing them from signing up and continuing? How does Nerva counter this with patient education during the 7-day free trial?
This is a great question. So as you've kind of cued into, the 7-day free trial, the biggest drop off we have in adherence and compliance to the program is at that 7-day point. In research studies, we typically see patients respond to gut-directed hypnotherapy around the 4 to 6 week mark. So we, in the app-based experience and then onboarding, kind of time the patient to expect that it's a process, and they have to commit to going through this process over the course of 6 weeks. We do everything we can to build that intrinsic motivation within those individuals, sort of framing it as a small commitment every day, working on themselves. And I think something that's useful. It's difficult if you're experiencing symptoms and you're looking for that immediate relief to have to go through that 4 to 6 week program. But if a patient could visualize themselves, feeling better, feeling more in control, 6 months from now, and all it took was a couple of weeks of a commitment of 20 minutes a day to get there, I think most patients would say that that's a very small commitment of their time and their energy and their money to get to, better management of something that has been controlling a lot of aspects of their life for a long time. It's also helpful from the referring provider side to talk about the fact that, this is evidence-based, it's recommended by guidelines. It does take 4 to 6 weeks, and it's a daily commitment, but it's short. You could do it right before bed. Tends to be a really enjoyable part of the day, and expect to see results in that 4 to 6 week time period. And setting the expectations for patients up front, I think, is very useful. When patients expect to experience relief in 7 days, that sets the wrong expectation about how gut-directed hypnotherapy works. It'd be like saying you're going to get relief from a single session with a therapist, which of course is not the case, or with a dietitian for that matter. So yeah, sort of priming the patient and setting their expectations tends to be the most effective way of getting them over that 7-day hump.
Awesome. We're just about out of time, but I have one more question that's been submitted because I really like this question. I'm going to squeeze it in. Are improvements with Nerva or gut-directed hypnotherapy more generally long-lasting, or do patients need to keep repeating the program to maintain improvement?
Yeah, that's a great question. So research studies show that the improvement that patients experience can be durable months and months later after completing the program. What we find in practice is that a lot of patients will come back to the app and revisit their favorite sessions when new stressors or triggers come in and out of their life, which happens to everybody. Um, like any muscle. Gut-directed hypnotherapy is training the brain to respond in a particular way to symptoms that may be false alarms coming from the gut, and strengthening that muscle and keeping that muscle strong over time tends to be very helpful for most patients. So that's why we give patients access to the app for 12 months instead of just 6 weeks, because that ongoing connection and touch point with the app is very useful. Anecdotally, I was talking to a gastroenterologist the other day who told me about a patient that he had referred to Nerva, went through the program, felt a lot better after the 6 weeks, but then ended up using the program when she would go out to dinner with her friends. And if she ate something at dinner that caused a little bit of gas or bloating in her stomach, she would step out for a minute, go to the restroom, throw in a session for a few minutes, and then come back. And it was just that reconnection with her, her gut brain axis, and reminding herself and her subconscious that everything is okay and I can go back to enjoying my dinner with my friends. And the symptoms I'm experiencing in my belly are not something to worry about. It wasn't a full session, but like nobody was the wiser that this patient had just stepped out for a few minutes to do a brief hypnotherapy session and come back and enjoy the rest of her evening. And I think that's a really powerful example of like real world how somebody can use a digital tool, which they wouldn't necessarily be able to get had they had to make a call to their psychologist.
Awesome. We will wrap up with that. Thank you so much, Joe. This was awesome, and some really good questions as well. And we always like to see that. So I know your email is here, and we have more information on the website that's linked, and the referral form is linked. But definitely reach out to us if you have any additional questions that we didn't get to cover.
Thanks, everybody.